Hi, this is Dr. Neil Gordon, and this is another episode of Setting the Record Straight, the truth behind your questions.
Why do some types of plastic surgery look fake?
People often ask me where the word plastic in the term plastic surgery comes from. Plastic is derived from the Greek term plastikos, which means to mold or to shape. But the real point of where people's questions are is the association with a plastic appearance in common types of plastic surgery. And frankly, prospective patients' biggest fear today is often that they're going to look plastic or fake. Examples of obvious or unnatural plastic surgery are not just reserved for people who couldn't afford better procedures. What's troubling to most people is that we often see celebrities, famous people, people clearly of means, who get outcomes that look unnatural that they wouldn't want on their own faces. The point of today's discussion is why does this happen and how can we avoid it? In order to effectively decipher this for everyone, the first thing is to understand what exactly aging is in our face. The majority of aging changes on all of us are due to gravity's effects on the soft tissues. The bottom line is we get a stretched out face that's in a lower position over time. If that's the problem, then the only solution to that problem is to lift or reposition what is drooping or sagging. The way it was done for years, and what is still the most common way to do it today, is to pull on a strong layer. The strong layer used in the past has been the surface or a skin layer. So, the more you look to lift and the more you look to reposition, the tighter the surface has to become. So in essence, what we start to see is a tight or windswept look on people who had facelifts. This is easily avoided today because facelifts of today do not require pulling or tightening on the surface layers in order to achieve the results we're looking for. One of the other common questions I get about people's facial appearance after a plastic surgery procedure is why do they look shiny or tight looking? Another reason for this was the use of strong and aggressive facial peels or dermabrasion or even laser treatments. Because those treatments are all burning methodologies, what they end up doing is thinning the skin and producing a lighter colored complexion that will often look shiny in appearance. Most importantly, none of those techniques approach our gravity changes, and we have to keep in mind that gravity and the reversal of it is what we're trying to affect. Today, we've seen an explosion in a new type of facial plastic surgery procedure, namely facial fillers and Botox. If we go back to understanding facial aging, we can understand where facial fillers and Botox will produce a positive result and a great outcome. But we'll also see that once gravity has had a significant effect in stretching out a face, the overuse of facial fillers and Botox will actually create a very unnatural appearance by overfilling a face that really needs to be repositioned. So today, overuse of facial fillers and Botox can get us in the same position that we were trying to avoid with old facelifts. The same is true for the use of Botox. Botox paralyzes muscles. The reason why we furrow our forehead is because gravity's effects on the forehead cause it to droop, and we use muscles to lift it. When we use Botox early on, we'll flatten out the forehead and everything will be fine. But once gravity's changes are significant, when we relax or paralyze the forehead furrows, our forehead will droop and start to cover our eyes. That, in addition to all the other things mentioned, are what people perceive as unnatural, fake, or plastic appearing in plastic surgery. So why is it that everybody wants answers through fillers and Botox? The reason is past facelifts didn't look natural. The bottom line is, if we don't reverse our gravity changes, we truly cannot get a significant result on a significantly changed face. But looking unnatural, which was the reason why we didn't want to do a facelift in the past, does not have to be our option today. Today's current and sophisticated facelift techniques, specifically the Deep Plane Facelift, takes a face that's stretched out, repositions it, not by using the skin layer that we've already defined, is not optimal in producing a consistent natural result. The way a deep plane facelift works is it uses an underlying layer of a material called fascia that has connections to everything above and repositions everything that's drooping from an underneath layer. By doing that, we never ever have to make the surface of our face look or appear tighter than it ever was. So now, deep plane facelifts do not require the surface of our face to look any different from how it did in the past. So we can truly go after gravity changes, which is the correct way to reverse our aging changes, and use a technique such as a deep plane facelift and reproduce the shape of our face and neck and never ever have to create a tight, unnatural, or plastic appearing, windswept look on the surface. Today, if you can understand what deep plane facelifting is, what it does, where you can get it, who can do it for you, what most people want is very easily attainable, which is a return of their past appearance with no signs that anybody like myself helped you along the way. I'm Dr. Neil Gordon, and this is another episode of Setting the Record Straight, the truth behind your questions.